Eye on Health, brought to you by Tallahassee Memorial Healthcare.
A traumatic brain injury can happen when a trauma to the head disrupts normal function of the brain, a condition that affects more than 2.5 million people annually. Tallahassee Memorial Healthcare is home to the region's only Level 2 trauma center and has been designated as a center of excellence in neurosurgery. Dr. Narlin Beaty is here to tell us more. Dr. Beaty, what exactly happens to the brain when you sustain a traumatic injury?
The brain is an influx of blood. It can swell, and you can get incredibly ill after traumatic brain injury.
So what kind of symptoms would you present with?
So we look for consciousness, confusion, headache, vomiting, nausea. All of these are important things.
Okay. Let's talk about some causes of traumatic brain injury, because I'm sure we can prevent some of this.
I think working with the community, working with organizations to reduce traumatic brain injury is very important. Obviously, prevention is our number one treatment. Treating motor vehicles, cycling incidences, golf carts, all of this needs to be avoided and done safely. And of course, we need to watch out for our sporting injuries.
Mm-hmm. So helmets, seatbelts, that sort of thing.
Yes.
Okay. Now, if say I do sustain an injury, what do I do? What's the protocol?
So if you sustain an injury that causes a loss of consciousness or a headache, any type of bruising to the face or ears, I think it's important that you come into the Bixler Trauma Emergency Room and be evaluated right away.
Okay. And what is it that makes the trauma center better than, say, an urgent care center for this sort of
The trauma center is equipped to treat all manners of traumatic brain injury, from the very mild to the very severe, and most urgent care centers are not.
Okay. All right. Well, then this is where you need to be. Thank you so much.
You're welcome.
To learn more about neurosurgery and other neurological services at Tallahassee Memorial Healthcare, please visit tmh.org/neuro.